And welcome back. This is Dr. Latasha McElwain coming to you with my clinical supervision, becoming a resilient leader presentation. And this is part 3 of the presentation. So we're going to skip on down. With the presentation here. So we have gone through a good bit of the presentation. We have done all the conversations about the history of supervision, clinical supervision. We have also gone through the vignettes and the case studies. So in part 3, we're talking about ethical and legal dimensions of clinical supervision. Some of the things we're going to start talking about for the most part is talking about competency, counselor competency, supervisory competency, also professional boundaries, dual relationships, therapeutic relationships, confidentiality, liability. And basically, when we start talking about competency, we're looking at to focus on the role of a counselor in developing introspect, awareness, knowledge, and skill to work with clients that are struggling with personal issues. And then when we're talking about competencies also, we have to make sure that the counseling skills, they have the necessary counseling skills, the knowledge, and the behavior that can be implemented to address the systemic barriers and issues facing clients. Additionally, competencies can also be considered a counselor's function that includes knowledge, skill, and attitudes. So counselor competency refers to a new counselor under supervision that are learning the skills and developing how to become a professional and becoming that expert. For the most part, they will be ensuring that supervisees inform clients of their professional status, meaning are they fully licensed, intern, assistant, if they are a associate status or associate level. So when we do have individuals come through our programs and sometimes sitting in a counseling office, it could be an individual that's doing their practicum or their intern hours, and they will let clients know that. They will, let them know what their professional status is at that time. If the individual is already under supervision, they'll let them know I am a LCAS-A or I am a LCMHA or I am a LPCA. And that will let them know that they're associate level, which is not fully licensed yet, but they are recognized by the state to be providing services. And then if they're fully licensed, they can tell them that they're fully licensed. So anything less than full licensure, usually we definitely want you to make sure that you put that out there, what your licensure status is. So when it comes down to supervisor competency, so supervisors are responsible for the supervisees, and they are obligated to the client, the public, the profession, and to the supervisee. So basically, the supervisor must be an expert of supervision and the processes of supervision. Okay. Moving right along, professional boundaries. For the most part, vulnerability, all that good stuff comes along with making sure that, clients are sharing private stories with you in this therapeutic setting. And, the feelings may become very powerful. Things may be, evoked, a lot of feelings and things like that. But having boundaries and making sure there are no boundary crossing. A lot of times when we talk about boundary crossing, it can range from, social contact outside of the practice setting, or excessive personal disclosure, or even sexual activity with the client. So we have to be mindful of what it looks like when we're talking about professional boundaries. Dual relationships. When it comes down to dual relationships, we have to make sure that we are definitely not exposing ourselves or increasing our risk to have potential for exploitation of our clients. So dual relationship can occur when two levels between the supervisee and the supervisor, and between the counselor and the client. It could happen in academia where the educational and the work context that may be including like a author, co-author, co-facilitator, and all that stuff, and graduate assistant relationship. However, supervisors must be aware of this and avoid exploitation and become less objective, avoid dual relationships that will interfere with the supervisor's professional judgment. So when we're talking about that, just making sure that you keep things on the up and up and everything is fully professional. A lot of times I just tell people stay away from it if possible. I try to maintain a very strict relationship with my interns when they come in as an intern through this university system, and when they come in as a supervisee, when they've already passed their courses and they've already graduated and they become a supervisee, we definitely go over dual relationships and boundaries there as well. Therapeutic relationship, development of a new counselor is very important, and as they're developing, a supervisor must be able to evaluate objectively to ensure that the supervisee is ready and competent. And the supervisor's responsibility to avoid allowing an impaired new counselor or to practice and they're not ready to practice, or continue practicing if something is going on. So a lot of times I work with my supervisees and talk with them about impairments, such as if you're feeling depressed or you're feeling like your anxiety level has is heightening, or if you feel like you have been in a situation, and because I do work with substance abuse individuals, they have experienced a relapse or something like that. So these are things that we talk about, and we try to make sure that we have a good relationship so that we can handle those things and cut things off before they get too far out of hand, and get it off where if they are impaired, they're not practicing and they won't continue to practice. So that's something that's always understood. The supervisor should refrain from the endorsement of an impaired supervisee providing services. So definitely that's not something that we we want to continue on. If someone's impaired, we want them to take care of themselves and focus on what they need to be doing for themselves versus trying to be in a situation where they're trying to help someone else, which could end up hurting someone else. So developing that therapeutic relationship there. And then dealing with confidentiality is very, very and extremely important that confidentiality is honored with all the information about the client. It is critical that we understand, and when confidentiality is broken, we do understand that, as well as understanding that supervisor and supervisee should be aware of and reviewed throughout the supervision period. Supervisor must ensure that supervisees are informing clients of their rights to confidentiality, as well as privileged information and communication. So this is very important that your client is aware of what confidentiality means and how we go about dealing with all of that. Liability. Supervisors are liable for supervisees. That's the vicarious liability that we carry in this role. However, pretty much the supervisors must also keep in mind that maintaining continued education, consultation, and other credentialing, counseling colleagues, and continuing documentation with sessions and counseling and supervision will also help limit liability. Supervisors are to ensure that supervisees are aware of ethical standards of practice, of professional practice. So that's something real big they have to be mindful of and very aware. So exploring the past, present, and potential future issues in clinical practice. So the past is pretty much to choose a supervisor based on their skill, not necessarily their relationship. So that's what the past was. Presently, We're looking at extremely competent supervisors that are the go-to supervisors, regardless of the interpersonal skill level. And the future of it will be more concerning with the social media and the internet. But for the most part, the internet is king to, basically getting out there and being publicized. So basically, we have to be careful and we have to be mindful and watchful about that as well. So with technology kind of ramping up, the future of where we're going with, clinical practice and everything else, we got to be mindful of that. We're doing a lot of we're doing a lot of work that is online now. We're doing a lot of work that is virtual. So we have to be mindful of that. So when we're looking at supervision, we're looking at the nature of self-care and practice in supervision. We definitely want to make sure that we are focusing on the fact that self-care and wellness is key. Those are big factors nowadays. I mean, I think they've always been big factors, but more so now because we're seeing the effects of a lot of different things, especially I will definitely say since the pandemic. So identifying self-care as a component of wellness, being able to take care of yourself and doing those things, putting those things in place to have a self-care plan. The theme of wellness kind of really emerged in the 1990s, but now it's definitely on the scene, front and center, and we have to make sure that we're taking care of ourselves, because what we're learning as counselors is that if we're not taking care of ourselves and sometimes even following our own self-care regimen, then how are we really taking care of other people? That's what I always say to my supervisees. And I keep trying to push that forward as my supervisees are moving up to becoming a counselor. And then they move into their supervisory roles under me as a new supervisor, moving on through their career. So a working definition of self-care can be the engagement in any activity which enhances an individual's overall wellness in accordance with the determinants of health that includes holistic health, prevention, and wellness. One of the things I will mention during this presentation is doing mental health wellness retreats, which is one that I have coming up that is going to be international and in Belize. That is something that I am really, really focusing in and horning in on when it comes down to being a supervisor, as well as being a counseling professional, a business professional, making sure that people are really taking time to take care of themselves. And if retreats is what they end up doing, that's fine. But again, it is something that takes you to a point where you're able to enhance your overall wellness, and be able to come back refreshed and rejuvenated to move on through practicing and continuing on with your clients. So counseling, accreditation of counseling, accreditation of counseling, and related educational programs, KCREP, pretty much they require that self-care be incorporated into counseling programs. So that's something you'll start hearing a lot more of when you're in counseling programs or in the counseling education part of things, that they are saying that, people have to incorporate self-care in. Another thing they do incorporate in is that those counselors that are in school also get their therapy themselves. So having your therapy, doing your self-care regimen, just things like that. And I'll admit, getting my own therapy and starting to do my own self-care regimen and kind of sticking to all two of them really makes a big difference in me being a therapeutic counselor. Also, it makes a big difference in me being a supervisor, and it makes a big difference in me being a business consultant with other individuals that might be in counseling or might not be in counseling. It does help me to feel more aware and more better about what I'm doing and how I'm taking care of myself. I like to use the saying, I try to practice what I preach. So that's just my little saying. But again, when it comes down to the ACA Code of Ethics, basically counselors monitor themselves for signs of impairment from their own physical, mental, and emotional problems and refrain from offering or providing professional services when impaired. They seek assistance for problems that reach the level of professional impairment. And if necessary, they limit, suspend, or terminate their professional responsibilities until it is determined that they may safely resume their work. Counselor assists colleagues counselors assist colleagues or supervisors in recognizing their own professional impairment and provide consultation and assistance when warranted with colleague or supervisor showing signs of impairment, and intervene as appropriate to prevent intimate harm to clients. So we definitely want to make sure that we are paying attention to ourselves and taking care of ourselves and be able to step away, suspend for a while, limit how many clients we got. So, I mean, that part of it right there is great, because like I tell people, well, we're not asking you not to practice altogether. We're saying if you can limit your clients, maybe if you're going from 16 clients to maybe 6 clients a week, or maybe if you're suspending services altogether, you're not providing any services for a period of time in order to get yourself together. And then if you're terminating period, we always talk about moving on and having some place where your patients are able to go to, just to make sure that you can take care of yourself, because you have to be able to provide services safely. All right. So now we're thinking about nature of self-care and practice and in supervision. We're going to talk a little bit about kind of, going through the steps here. So in 2010, there's a study about vicarious trauma found childhood trauma and personal wellness had a significant impact on vicarious traumatization. All right. Additional studies show that the number of hours worked with trauma specific clients had a direct correlation to psychological distress in counselors. That was in 2014 when that one came about. And then later on, there was another study that also talked about Supervisory Alliance found professional distress of supervisees had a direct impact on the Supervisory Alliance. More research talked about the clinical supervisor supervision alone as a protective factor has achieved mixed results. And then also talking about the study of self-care and mindfulness found self-awareness alone is not necessary for self-care, nor did it have any positive impact on overall wellness. So a lot of research is happening out there, and a lot of different, minds, or a lot of different studies coming up and just saying different things. So just wanted to put that out there. Also want to explain why self-care is an ethical impairment. So, and it's definitely imperative that we take care of ourselves. So when we're looking at that, we're talking about self-care activities where directly correlate to an increase in overall wellness. And it does do that. I mean, I can state that it does that, of course, because I do a lot of self-care. Introducing the concept of wellness into the Supervisory Alliance mitigate the impact of supervisee stress on the supervisor. So another study is basically that the wellness model of supervision was found to be a protective factor for both the supervisor and the supervisee, which definitely makes sense and gives us a good reason as to why self-care is so important. Other things to think about: begin to create an environment of safety, the supervisory relationship, humor, clear focus to include wellness. So clear focus to include wellness, and then be genuine and congruent to the model, as in, practice what you preach. That's one of my favorite tunes, practicing what I preach. Our actions are equally as important to our words, and we have to be cognizant of remaining non-judgmental and avoiding shame, no shaming. So yes. Now moving right along, explain why self-care, is, an ethical imperative. Again, health. We're talking about pretty much getting some help out there, developing a consistent plan to engage in mental, emotional, physical, and spiritual nourishing activities, such as, different things that you do for yourself. Some people try to meditate, some people get out and take a walk, some people take a long nap, different things. What does that look like for your supervisee in each of these areas? And be specific with activities, intervals, and follow up. So that's something that supervisors can definitely work with their supervisees to be able to help them to develop and to move forward with scheduling, rejuvenation and restoration, time to restore, around times of high stress. So may have high stress times when things are going on. What might these look like for your supervisee? And are there certain times or certain clients, etc.? Those things can be, kind of looked at in the routine, the pattern. I remember walking into an office and asking a therapist said something to me about it being so busy. And I said, well, is it normally busy this time of year? And they were like, well, no, this is the first year where they're really like hopping, hopping, hopping. I was like, wow. So that's interesting. But I asked her that, not that she was my supervisee or anything, but I asked her that because sometimes people do notice that a certain time of year they start hopping and start being real busy, and they really have to take care of themselves and realize that that's a high stress time. So things speed up, things slow down, speed up, slow down. So you have to be able to manage that and take care of things. Prepare a list of emergency strategies. So basically, we talk about preparing a list of emergency strategies, just incorporating any policies and expectations surrounding incidents in your agency, as well as know your supervisee's area of strength and difficulty. So being able to understand and help them, in areas where that they may not be that strong in, or areas that they're very, very, they're very extremely strong and can really manage through that, or if they're going to have some difficulties or whatever the case may be, being prepared for those things and kind of knowing your supervisees. And then explaining again more about help, regular meetings with peers and colleagues for support to basically avoid isolation. And that's with supervisees and for the supervisor yourself, just making sure that you're getting out and doing some of these things as well. Evaluate job specific challenges to self-care, such as work performance expectations, high stress environments, as well as the commutes and things like that. And a lot of us don't commute anymore, but it's stuff to consider. Record and review successes, as in what worked well, and then what didn't, and how can we change that, looking at those patterns. And then include self compassion, as far as granting grace, granting yourself some grace, giving yourself that level of grace. Remind that knowledge does not translate into action. So I am perfectly aware of how stressed I am. Just being mindful of what's going on. If you're perfectly aware of it, then take time down and take care of yourself. Okay. So there are a lot of things to think about there as well. In conclusion, with self-care. So the biggest thing with self-care is basically in the area of professional development. It is a growing concept. A lot of times we're looking at integration remains poorly defined, introduction of wellness, a starting point, and then start with the accreditation expectations of wellness in the areas. These are things to think about, as well as the hazards of professional work. And a lot of times the hazards of this professional work is the fact that it can contribute to a lot of burnout of staff and poor client outcomes, of poor client care. So we have to be mindful of that as well. And then we're talking about ethical codes that have clear implications of impairment of professionals. So really understanding that, as well as understanding the distress within supervisees, that has clear implications for supervisors. So there are clear things, sometimes implications that you can tell that the supervisee is totally in distress. Then moving right along, just talking about the clinical supervision alone is not effective at managing the stress in supervisees. So the clinical supervisor does need to have some skills, but it's not effective to manage the distress and the supervisee alone. It have to be a tag team approach, you know what I'm saying? So it have to be some conversations being had. And then utilizing a model of clinical supervision, which encompass wellness in a intentional manner, can provide a buffer for both the supervisee and the supervisor to make sure that they are working through and taking care of themselves in general, and that the supervisee understands where the supervisor is coming from when they are concerned about them in self-care. So self-care should be individualized and encompass into every stage of professional development, as well as integration and reevaluation, and is necessary for building competency in self care and wellness. So, in conclusion, we learned, reviewed, and discussed the four personalities of leadership. We also talked about the clinical supervision models, and we also talked about the ethical and legal dimensions of clinical supervision, and we talked about the ethical standards of self care. So, with that, we are done with part 3 of the clinical supervision um, presentation here. And we have all of our references added here for any additional information that anyone feels that they would like to follow up on and take a look at. So, with this presentation, I am hoping and praying that everyone got something majorly important out of becoming a resilient supervisor, so that when you do become a supervisor, you're able to move on and continue your career in other areas as well, and you're able to give back. That's one of the reasons why I became a supervisor. I wanted to give back and really be a part of this profession and actually help shape people's career and help them figure out where they want to go and what they're wanting to do with this level of work and education that they're doing. So, with that being said, this is the end of the presentation. This is the part 3. We have part 1, part 2, and part 3 of this presentation. This was a 6-hour long presentation that I completed a couple of years back during the COVID and the pandemic. And we were also, it was our first webinar presentation that we were doing. So I hope everyone enjoyed this, and I hope that everyone gets something great out of this entire part 1, part 2, and part 3 of this presentation. Thank you. Again, this is Dr. Latasha McElwain. I hope you have a wonderful day, evening, or morning, or whatever time of day you're hearing this message. Thank you.